Hi, this is Elliot Kallen, and welcome to our fourth episode of Meet the Expert. We're very excited. We've now had a few hundred people on these episodes listening and watching or listening in their car. So whatever works, we're going to also turn these into podcasts for those of you that like podcasts, because we're getting a lot of calls for it. And just as an example, for the one that we did last week, we had 100 people when we replayed it, turn it on in the first 5 minutes. So that's great. Coming from nowhere to somewhere, we're very excited about it. And our goal is to educate you. There's no product specific sale here. You can't ask for a product. You can make some questions. You can make some chats. If you have questions, just put it on the Q&A. Your Q&A is at the bottom of your screen, and I will ask our guests the question. So we're still in quarantine and still in prison here, how it feels in California. We're getting better. It's loosening up. It's opening up a little bit. Unfortunately, people are still getting sick and people are still dying. That's not going to change probably for 2020. We have our mask here. I thought I'd have a little bit of fun. I am a Rangers and a Sharks hockey fan. If you can see that, that's my New York Rangers mask. We just got them, and we have them for the office. And I still have my New York Jets mask coming. Everybody in the office, they could choose hockey or football, and you'll have a little bit of fun with that too. Although I feel like I have a face for radio sometimes, but the mask makes me more palatable, at least for me. So we're going to talk today about the cost of healthcare and retirement. I do want to tell you that we're doing this again with a different topic a week from today, but instead of at 4 in the afternoon Pacific time, it'll be at 10 in the morning. We're trying different times. All of these are being recorded and being replayed for you, so you get to listen again. So that's really good. If you missed it today, you share it with friends. It's absolutely free. And then next week, we're going to invite the folks from JP Morgan to come on up and talk about what's happening in the market and from a financial standpoint, how to thrive, how to prepare for the fourth quarter. We are with portfolios, repositioning them almost every day, very, very tactical, very surgical on how we're going to take advantage of the upswing, particularly in the fourth quarter that we think is coming. And we're also going to talk a little bit about, since we're talking about healthcare costs and retirement today, we're going to talk about a checklist of what you should have available between a couple or when you're alone of what to do if something does happen. Sounds like a very negative topic, but I know from my father, when he passed away and he was old school, my mother had never signed a check in her life. And he had passed away and she had to sign everything, and that was brand new. So we're going to talk about that type of subject. So let's talk about today, important subject for people that are 55 and older, or they're part of the sandwich generation where they have parents that are older, whatever that might be. But this is important now. How much does it cost to live in those golden years? How much does it cost to live in retirement? Some people think it's free. Some people think, well, I paid medical, I get Social Security. I'll just apply on my 65th birthday for Part B, and then after that it's free. But in reality, when things do go downhill, they go down very quickly and in a very expensive way. So today we have the folks from Fidelity on, courtesy of Transamerica. We have Marianne from Fidelity, Hobeika, and she's going to speak about the cost in retirement. And then she's going to bring it back to me. She's our only speaker. She's going to go for about 40 minutes, give or take. We'll ask questions. In between here, I'll hit the questions. If you do have questions, just send them. I promise to look at them, and I promise to ask the questions for you. And we look forward to it. So Marianne, come on and I'll start your presentation.
Perfect. Thank you, Elliot. Thanks for introducing us here. Really great to partner with you. And one of the best things that we do at Fidelity is actually work with all of you as shareholders, right? And we get to really understand what's worrying you, what's on the top of your mind, what are you thinking about? And one of the biggest topics is healthcare. So it hits near and dear to me since my folks are turning 65 this year. So while you're going through this potentially in the next several months, next couple of years, or maybe you've already turned into retirement at 65. This is a relevant topic, and so we're going to just go through what you should be thinking about when it comes to healthcare expenses. And I will say a lot of folks underestimate these costs, and for a multitude of reasons, including, but not limited to, the fact that they think it's free. I've been paying into the system for my whole life. What do you mean I have to pay? So if that's you, don't feel like you're alone, because that's pretty typical. So on the agenda, what we're going to do is we'll talk a little bit about the healthcare costs. I might have a couple numbers that'll play a little bit of sticker shock for us today, but fear not, because we're going to look at what Medicare actually covers, what it costs, but what it doesn't cover as well. So things you want to think about beyond just the typical coverage. And the nice thing is we can figure this out. We have a process. It's pretty easy to follow. And it's a great way for you to sort of increase that mind share in that sort of, the way you should be thinking about healthcare is not overwhelming. It's actually quite approachable and doable. So healthcare is obviously on the rise. And if I take you back to the 60s, and no, I was not born in 1960, although it's pretty nice to be able to look back and compare GDP then versus now. And we only had about 5% of our GDP that was attributed to healthcare costs. Fast forward to today, you're looking at almost 20%, which is really, really crazy. So what it translates to in dollar terms is that while it used to cost you a little less than $150 a year, now we're asking you to put over 10 grand, and depending on where you live, that can certainly climb, and you will see that it will be 14, 15, 16 grand easily on just having basic coverage. So it really comes to a multitude of factors that are driving up the cost. And I think all of you know, right? For example, if you think of the EpiPen scandal, you know how those drug companies are constantly increasing prices year over year, monopolizing the industry, and it takes a lot longer for a company to jump in and play competitor with some of these newer drugs. So innovation is a big reason why costs are going up. It's funny to me that, while we have Medicare coverage as well, you'll see that on the slide, medical services, for example, the ER will charge you anywhere from 1 to 12.5 times what your Medicare will actually pay for. So that leaves you with kind of this big unexpected bill, which kind of stinks, right? And so the list kind of goes on in terms of why healthcare costs keep going up. So if, typically when this is in person, right, I'd ask you, how much do you think it's going to cost you out of pocket for healthcare? And if you said anything below $100,000 for your lifetime, so you would have been just like about half of our market participants that have responded to Fidelity surveys. And so most people underestimate their healthcare costs in retirement by at least 50%. And what we've said is, well, based off of all our number crunching and our studies, and we've been doing this for a decade and a half, based off of all of that, Fidelity anticipates that if you are 65 and you are healthy and you're living, let's say, an average 20-year into retirement life, so from 65 to 85, we expect that you're going to be paying $285,000 out of pocket. So what does that actually mean? It really depends on you as an individual, and this is a national average, but 40% of that number is coming from all the cost-sharing provisions. You'll see that on the green there. So any co-pays and co-insurances and things like that. You've got about 40% that's coming from Part B and D premiums. We'll touch on what Part B means and what Part D is. And then lastly, you've got about 20% of the pie that is a result of out-of-pocket drug costs. So the point here is, this isn't something that we should overlook or forget about, and we can definitely come up with a plan together and make sure that you're feeling comfortable. And don't feel like when you're going through this presentation today, I don't want anyone to feel like you've got to take a bunch of notes and know all the details and all these things if that's not where you're at, right? Like, I think this is a really good time to just take a step back and get the bigger picture, so that when you're ready to research and ready to personalize this in your life, you'll feel a lot more confident in the subject matter. So, and remember, this is all individualized. So what I mean by that is, let's say Jack and Jill are married. Jack might need a certain Medicare plan. Jill might need another one, and it's based off of a number of things: life expectancy, years in retirement, general health, how much coverage do they want, do they travel, do they not? So if these are questions you've been thinking about, that's very typical, and we're going to address all of that today. So like I said, we'll talk about Medicare, we'll talk about estimating your cost, take fund of some of those income sources to help you pay for it. And then of course, it's a great excuse for you to reach out to Elliot and say, hey, I want to come up with a plan. So let's jump into Medicare. And for all of you that are stuck at home like me, and you don't know me, but I do travel a lot for work, and I travel all across the West Coast. I love jumping on planes. And I will tell you, I don't want to travel for work after this is done. I want to go on a vacation. So the way I think about Medicare is simple. You've got two major options when you turn 65. So for example, you have original Medicare. Original Medicare, and I'll talk about what it constitutes. I kind of think of original Medicare as, when I go on a vacation and I don't want anyone to tell me I'm stuck in one resort and I can go do whatever I want, travel Europe, travel, inside the resort, outside the resort, and just kind of pick all the monuments I want to go to. So I say that because original Medicare gives you more flexibility on which doctors you want to see, etc. And you got to do a little research before, but that's a general statement. Then you have Advantage plans, which is Part C. A lot of you have probably heard of Medicare Advantage. That's a little bit more specific. So if you're in a specific location, you don't travel a lot, you know your doctor's covered in the Advantage plan, it might make sense for you to use Part C. That's kind of like an all-inclusive resort. Everything's sort of bundled up for you. You don't have to worry about additional coverage. And sometimes they actually include drug coverage as well. And it's just kind of a package deal. Okay, so those are your two big options, original Medicare or an Advantage plan. So let's talk about original Medicare. Part A, you have your hospital insurance. And, I think of this as sort of your basic, super basic coverage. And it's what a lot of people think of as free Medicare. And what I mean by that is if you've paid into the system, you've had 10 years paying into Social Security and working, you got 40 quarters of wages, you can qualify for this premium free. So that's where people, associate free with this program. The caveat here is if you use it, if you go into the ER for any reason, that's when you start to pay a deductible, a per day co-payment, and you jump into your reserve days and things like that. And ultimately, if you're not properly covered, you could be responsible for all the costs out of your pocket. So the key here is if you don't have proper coverage, and we'll talk about maybe thinking of a Medigap policy, for example, you could have unlimited costs that you have been burdened with unexpectedly as you were sent to the ER, and you just didn't realize that you weren't properly covered. So that's Part A, hospital insurance. It's not free, and if you use it, you're going to pay for it. Okay. You got Part B, which is your medical insurance. This is, easiest way to think of this is B for basic. So if you are, if you're joining in Medicare Part B, you'll have to pay for a premium. And so typically most of Americans will pay about $145 every month. And their premiums, depending on their income, obviously, that'll dictate how much they have to pay. So it can be anywhere from $145 all the way up to maybe close to $500. Now there's two additional parts here that are really important. Number one, there's a deductible. It's an annual deductible of $200. Not too shabby, right? $200, it seems a little, it's affordable, right? We can figure it out. Once you pay it for the year, you're good. It'll renew the next year. But here's the caveat. If you've got a 20% coinsurance, you'll see that right on the top, a coinsurance that you're responsible for, that can add up. So, how much do you think is the maximum out of pocket here? And if I were with you today, I know some of you would take a couple guesses, maybe say 5,000 a year, 10,000, and to which I would respond, I wish, because the truth is it's unlimited. There is no max out of pocket for your coinsurance. In other words, I'll give you a great example. My mom is about to get a knee replacement. And on average, you're talking about maybe 50 grand for that knee replacement, from the labor to the x-rays, to the material, to the surgery, right? There's a process. 50K is relatively cheap for a knee surgery, and we all know someone, right? So if I'm paying 20% of 50K, that's about 10 grand that I'm being asked to pay out of my pocket for this surgery. So the question is, how do we make sure we're not paying unlimited amount of money for unexpected health events? So we'll get into that in a little bit. But think B for basic. Now, I talked to you about Part C. It's an Advantage plan. And 30% of the US is signed up and enrolled for Part C, and it's actually increasing. So more and more people are interested in Part C. Why? Well, these are your HMO and your PPO plans, and a lot of times they're sort of, like I said, they're that all-inclusive. They've got your A and B that we just talked about. Sometimes they'll add in your drug coverage as well. And they'll also add in, you know, hearing and dental and vision and some other things. So it's an appealing program for a lot of people. Now, the reality is,
Maria,
yeah.
so when we talk about Kaiser in California, are we really looking, because it's an HMO and it's so dominant here, really this is probably what the Kaiser program is all about?
Yeah, and there's no so there's no right or wrong for everybody that's enrolling and things like that. I know Kaiser's a name in California that people recognize and trust and have known, you know, and grown around, and it really comes down to me as the individual. What do I need? What coverage do I need? What's appropriate for me? Am I traveling? And these are the questions as you know, enroll in something. Don't just blindly enroll because you're, you know, maybe your neighbor enrolled in a Kaiser plan, or maybe your neighbor enrolled in this type of plan, because it really truly is based off of your specific situation. You know, I will say, and this is, it's important to note, if you enroll in a Part C plan, in an Advantage plan, and a year down the road, 2 years, 5 years, 10 years down the road, you decide this isn't enough coverage for what I thought I needed, you know, XYZ has changed in my life, and I'm going to have to switch to original Medicare because it seems to be covering more of what I need, right? And so you'll want to go back to a Medicare original plan. Now, if you want to add a Medigap policy, which we'll talk about in a few minutes, that actually they reserve the right to refuse you coverage because they're private plans. So I'll talk about that in a little bit. But does that help? Does that give color, Elliot?
Sure. There's just some people I know think that Kaiser is a free program. You know, it's free. I've been on it for 25 years. I paid in. I have a $10 copay and zero deductible from the old plans. So they think that's just carrying over into their retirement, and that they could have hip surgery, knee surgery, you know, and gallbladder out, and it's all free.
Yeah. Yeah, you're totally spot on. And then the bills start kind of racking up, and then we're left trying to figure out what to do from there. So with that said, both plans, whether you choose Advantage or Original, you need to consider your drug coverage as well. Luckily, drug coverage isn't too pricey. It's about $33 a month just for, you know, your average plan. If you are adding, you know, if you made more money, obviously you pay a little bit more for the premiums. But for the most part, the drug coverage is important. If if right now you're not taking any medication, right? But 5 years down the road, you start to take medication, and you say, oh, well, I think I'm going to have to enroll in Part D now because I my situation calls for more drugs. And the problem here is if we don't enroll, it's your individual choice. However, if you choose to push off enrollment for Part D, there's a 1% sort of fee that's added on each month that you delay. So if you delay 12 months, 1% gets added on for 12 months onto that premium. Now, 1% of a premium isn't too much. So some people say it's not worth it, etc. I'm going to end up paying more. It's up to you in terms of coverage. But let's actually talk about what that drug coverage looks like. And I love and hate this slide. And for those of you that are looking at the slide right here, I just want to, I want to point out a couple things. Don't worry too much about the numbers. Just think about it this way. If you have coverage, that's great. For a certain period of time up front, you're going to be paying a deductible. But once you pay your deductible, then Medicare jumps in and says, we're going to pay a certain portion. You just have to pay, a quarter of it. And then you kind of keep going through this, this donut, and then you get to the donut hole. The donut hole is essentially a gap in coverage. So Medicare, you think Medicare is paying you 75% of the drugs and you have to pay 25. All of a sudden Medicare, there's just like this additional gap, and you continue to be paying 25%, but it's for a bigger chunk of change. So all up and all in with the deductible, plus that, you know, the 25% for the initial coverage, and then the donut hole, you could be you know, responsible for $6,300 out of your pocket for drug costs. So, you know, I'll share a story with you, and then you kind of get to your catastrophic coverage, which is extenuating circumstance. You know, it depends on your situation, but I had a friend of mine who was a triathlete, healthy lifestyle, you know, did everything by the book. And actually one day he's an advisor. He was sitting in one of these presentations, just like all of you. And he said, Maureen, I want to share my story with you, share it with everybody else if you can. So I want to share this with you all. So you know, he was diagnosed with stage 4 lung cancer, and unexpectedly, and the doctor said, you either go through chemo or you take this alternative drug, a daily pill that's supposed to be less invasive for your case. He said, fine, I'm going to do that. How much is this going to cost me? So by week 2 of every year, he's gone through this entire chart that you're looking at. So he's paid the deductible, went through the donut hole, and then he got to catastrophic coverage by week 2. Now, remember when I talked about, you know, costs being innovative, you know, healthcare being so innovative, and that's a big reason why costs are going up. This is a prime example, right? So he was able to stay alive by taking this pill, but it cost him $6,300 by week 2 of January, and then $700 for this daily pill for every month after. So 700 times 12 months plus 6,300. You're looking at around 14 grand that he had to pay out of pocket. So
I feel terrible sometimes. I go to Costco to pick up a prescription, and you could see some of these seniors here in their 70s, and they are just they have 8 pills for 8 prescriptions, 10 prescriptions in front of them, and they're getting an $800 credit card receipt. You know?
Yeah. Yeah, it's not a joke. It's not a joke. And I think it's a great point, Elliot, and we don't wish this on anyone. I just think you can't predict anything in life. Sometimes you're handed a bill, right? And then now you have to backtrack and think, oh man, I wish I planned for something else, or I wish I was properly covered, things like that. So, and sometimes people say, hey, I thought I was covered, and then I wasn't until I realized that my drug plan didn't cover this drug, etc. So there's a little bit that goes into it.
There's a question here. It says, if I receive full health coverage from my employer after I retire for myself and my wife at a cost of $350 a month, am I better off continuing the coverage or switching to Medicare?
Yeah, so I would, you know, that's a great question. If you are still receiving coverage for $350, it's going to depend on, and you know, that's especially if it's you and your wife, right? I'd have to look at the numbers before I would say anything, but historically, based off of what I've seen in the marketplace and depending on your level of coverage, sounds like a pretty good, you know, at first glance, David, that sounds like a pretty good deal, right? But you just have to do some number crunching, compare the, you know, whatever your coverage looks like at your company, compare it to, you know, a Medigap policy, which we'll talk about in a minute right now, and see what the costs are going to look like. But yeah, we're anticipating that. I mean, my gut tells me that might be a good deal, but I'd say talk to Elliot on the side, and hopefully we'll get you some more color. So, and that leads me to a Medigap policy. So remember when I was saying, you know, hey, this is going to be super expensive, and there are unlimited costs if you go to the hospital, unlimited costs if you have a co-insurance, drugs cost this amount. I mean, this is crazy. And at this point, people are, you know, you're just kind of like, well, what do I do? Well, luckily we've got Medigap policies. There's supplemental insurance plans that are privatized. And basically you've got different levels of coverage. So you can see there's plan A to N across this, the page here. And there are different tiers of coverage. I'll tell you, historically, the most common was plan F. And that one gave you the most comprehensive coverage, which is why it was the most popular. Today, if you are just newly eligible for healthcare for Medicare, it's no longer available. So if you were eligible last year or the years before, you can still buy into it. But if you're turning 65 this year or in the future, you are no longer, you can't access Plan F. The good news is you can access Plan G, which is the second most comprehensive plan available. And so that one basically, remember that 20% coinsurance? Well, that's covered. That's pretty nice. So now my mom's got a free knee surgery, right? You've got Part B deductible, for example. That's part of those. So for those of you who have enrolled or were eligible beforehand, that might be older than 65 this year, you're getting that deductible, that $200 covered. If you're traveling, there's some coverage there as well. If you go to the ER when you're in Spain one day, and so they'll do some coverage there. It's nice. So these policies basically put a ceiling on these crazy costs that we were worried about. Like I said before, they don't include prescription drug costs, so you still need that Part D plan if you need to sign up for that. You're still not getting your dental, vision, or hearing that you could get in an Advantage plan. So you want to kind of consider and weigh out your options there. But it sounds like there's a question coming in.
Maria, and yeah, a question came up about dental, vision, and hearing aid insurance in retirement. Is that a good program or is that not a good program?
So what do you mean by good program?
Is the money worth it? Because that's you have to pay for separately. So like for instance, if you look at my dental premium, my premium just about equals what 2 cleanings are a year with x-rays. It's the same amount of money. If I get a cavity, I'm ahead. A root canal, I could be way ahead on the whole thing, even though I have to pay for half. But if all I get is my routine, cleanings twice a year and x-rays, and my teeth are all kind of still my teeth, I'm not working in a world of implants or dentures, then I'm not ahead or behind. But after that, it can get pretty pricey.
So yeah, no, that's a great question. And the way I think of the human body is kind of like a car. The older we get, the more miles we put on our bodies in a sense, and naturally you're going to need more attention. And I think the key here is, while today we might be healthy, you never know what can happen. So expect the unexpected. My dad used to say that to me growing up, is always expect the unexpected when he taught me how to drive. And so the key here is this is insurance, right? No one wants to use insurance. I don't want to go to the hospital once. I hope I don't have to do any of this stuff. But what if something happens and I do need a root canal? What if something happens and what if I fall down the stairs and I broke my tooth? Now you're looking at a tooth, I don't know what they call it, but like a veneer or something like that, right? So you have many, many examples of people that have said, I don't want insurance, but realized, wow, I should have had insurance, or I wish I had insurance. That would have made my life a lot easier.
I guess one of the issues there is if you are going to get supplemental insurance, make sure your dentist is on the plan.
Absolutely. And you can, again, so for all of these discussions, you're right, Elliot, like this is, we have to be, honestly, it's like shopping. You've got to be a consumer. You have the right to ask questions and be as a quote unquote annoying as you want to be, because you're giving them your money. I will say, so for example, let's say you've decided on Plan G, this is the right one for you. You're going to be left with a whole group of, private plans that are going to try to win your business, earn your business. You've got United, you've got Kaiser, you've got et cetera, et cetera. So the list kind of goes on. AARP, Mutual of Omaha. The question is, which one do I choose? And ladies and gentlemen, if you choose Plan G, it doesn't matter who you choose, which company you choose, you're getting the same doctors, the same level of coverage. It's all standardized. So between you and I, as long as the company is reputable and you're like, hey, they're not gonna go under any time and that sort of thing, pick the cheapest one. Pick the one with the lowest premium, right?
I did notice that my doctor had some time ago, had a sign in the front that said, I'm sorry, our Medicare patient list is full, or something like that. they were no longer accepting Medicare patients. Is that common?
That can happen. That can happen in California. And if it's an office specifically, yeah, I mean, that can happen. They have, you know, people have the rights to say we're at capacity. So you got to do a little bit of digging beforehand.
Thank you.
Yep, of course. So here's the idea behind all of this. You know, if you're looking at different plans, we've kind of addressed some of this before, is let me consider, hey, do I need to see a specific specialist? Do I have flexibility in terms of which providers I want to work with? You know, what am I estimating that my out-of-pocket costs are going to look like for my drugs? Is it important, crucial for me to continue seeing Dr. So-and-so? Or can I, you know, maybe jump ship and go somewhere else that does accept new patients? You know, what's not covered? Let me consider kind of what we talked about earlier. Do I need dental, hearing, vision, things like that? Am I ready for an unexpected catastrophic illness? So these are things you just want to, and we've been talking about them, we want to consider, but I wanted to, you know, break something down here for you all. So we talked about a Medigap plan. So let's say you decide, I'm sold, I'm comfortable with Medigap, I want to choose original Medicare, which is A and B. I'm going to buy that Part D premium plan, right? And then I'm also going to add on Plan G. So we've basically broken down for an average couple that's making less than $174,000 a year. We broke down what it would cost them. So all up and all in, it's about $7,000 per person, or around $13,000, $14,000 for the couple. So what you could do, you could do this for yourself, right? You can kind of fill in the chart and work on your own plan. And it's really easy. We can share worksheets with you and things like that. So a lot of resources available that Elliot can share with you all. But the idea here is that, let's say you're going to live 25 years, 30 years, you know, you went from paying $285 out of pocket because you thought you were going to live for 20 years. Now you're at 30 years. So that's an additional $140,000 that you're going to be paying for healthcare. So you want to consider life expectancy as a huge part. So at the end of the day, you know, this is just a matter of taking an inventory of like, where's my guaranteed money coming from? Let me make sure I cover food, shelter, as well as healthcare. Those are like the key elements of our retirement. And that kind of affords you that peace of mind. Then you can jump into some of your mutual funds and IRAs and things like that and say, all right, now I got some, you know, gaps that I got to fill. And then lastly, and that's okay. And lastly, okay, we're comfortable. I've at least paid off my health care and my, you know, you can pay that through your Social Security check, right? They take some of your premiums from your Social Security, paid off all that stuff. Then you can start thinking about that, maybe that extra vacation home, or perhaps that trip, or spoiling the grandkids, whatever is of value to you in your life. So it's based off of what's dependable in terms of your income sources. So at the end of the day, I'll turn it back to Elliot and say, hey, this is all about creating a plan. So that's what Elliot's there for. And I'm going to pause right here and see if there are any specific questions.
So I want to talk a little bit more about that dental issue, because that's come up a few times where it seems that dental in retirement gets very, very expensive. And so we talked about $250,000 of cost in your retirement. And it seems like a big portion of it is, I need bridges as I get older, I need implants, I need all these things which we didn't need in our 20s and 30s, unless you're like me and you're a hockey player. And then you need all types of things in your mouth just to keep your head together. But you're spending more money in retirement. What do you recommend for people that are just scared of spending this silly amount of money on their teeth?
Yeah, it's about, you know, I was having the same conversation the other day with a close friend. Life is a series of choices. No one in this room has to do anything. You don't have to buy, you don't have to, however, and maybe it's expensive, or maybe it doesn't seem reasonable. I would just say any decision you make, there's no right or wrong. Just make it an informed decision. So do a little bit of planning beforehand and research.
Yeah, let me ask you about hearing aid companies. You know, we all see that commercial where we're talking about, the gentleman's talking about woodworking, you know, that hearing aids can be $2,000, $3,000, $4,000, whatever they can get. And he went to Costco or he bought them online for $495 to $700. Are they doing it? Is that real? Is there a difference between them? And then how do you handle it in retirement?
So you're saying that the hearing aids cost them $3,000 or $4,000?
Well, if you go to a hearing aid store,
yeah, yep,
they're thousands of dollars. If you go to Costco, they're hundreds of dollars. Or that company that advertises online, I don't want to say their name because it's not a commercial product. I mean, it's a commercial product. But what can somebody do from an insurance standpoint?
Yeah, I mean, generally they're not covered by Medigap, right? Hearing aids generally isn't covered by any of that stuff. So you might want to, that's a great question. I haven't really personally gone through any hearing aid research, so your guess is as good as mine. So maybe if you've heard of that, I'll turn it back to you, Elliot, because we just know it's not covered. I don't really
it's not covered. It's not covered in a Part C.
In Medigap, it could potentially, listen, it could potentially be covered in Part C in an Advantage plan. You just have to do some, you just have to do some research and see which ones do.
As a New York Jets fan, I saw Joe Namath advertising several times a week for their Medigap product that he was a spokesperson for. And it listed, and he wasn't the only one, they've got some retired sports figures, and it listed dental, we cover hearing aids, we cover colonoscopies. I mean, they covered everything that was not covered somewhere else. So these exist, but I assume they're reimbursement programs.
Yeah, and I think Advantage plans, the really nice thing about Advantage plans too, which is why I think part of it is, you know, they're increasingly popular at this point. They do have additional coverage that you're not getting with some of those original Medicare plans, which is why people start, you know, you kind of teeter and you're like, which one makes more sense? And so people might have heard of like the Silver Sneakers program with the Advantage, like Part C with those Advantage plans. So they'll try to entice you. They'll say, join us, we'll give you a free gym membership, we'll give you hearing coverage, because they know they're picking at the Medigap policies, because you can't, it's one or the other, right? You either got a Medigap policy or you got Part C. You can't intertwine the two. So there is a little bit of corporate competition there. That's why that's why I say, like, it's such an individualized decision. It truly is. But that's a great question. And not all Medigap or Medicare Advantage plans are the same. You have to type in your zip code, and it might be different in San Jose than it is in Los Angeles than it is in San Francisco, right? And across the whole country. So the plans aren't the same across.
We did have somebody that just made a comment that said they bought hearing aids for about $2,000 at Costco and they love them. And I can't tell you that they didn't like them beforehand somewhere else. But I know there's a gentleman that, and his hearing aids are thousands and thousands of dollars, and he makes a lot of money selling these boutique hearing aids. And I'm like, wow, they're just, no, that's why there's a commercial on TV for them. So on the same note here, if I decide that I want to leave California and move to, you know, cold Nevada or sunny Florida, can I take these with me?
The hearing aids?
the coverage.
So if you change, so there's, if you move or if a plan no longer is available in a certain geography, then there's flexibility there in changing your coverage plan, which is nice. So it's not your fault if a plan is no longer out. You know, sometimes what will happen is you've got a Medicare Advantage plan, and then the company pulls out their plan in that zip code, and then they're gone into some other land. Or maybe you move across the country and they don't have that coverage, you know, in that new state. So you will from California to, I don't know, New Hampshire. I grew up in New Hampshire, so I use that as an example. and they don't have a specific Advantage plan there, then you just got to shop around again, and no one's going to penalize you for changing that. It's not.
So that could affect. So Marianne, that could affect Kaiser people because Kaiser is state specific. They want to retire in Texas or Florida. They don't give up their medical. They give up their Kaiser, but they do have the ability to replace it with something else.
Right. And so that's why, and what I was saying before is, Medicare Advantage is so geo-based. So if you are moving, it gives you a little bit less flexibility. It might be cumbersome for you to change. But if you're looking at an Advantage plan, then, or, a Medigap policy, those are, or like original Medicare, those are usually pretty universal. But again, if you're moving, there's going to be a checklist of things you got to do. So you do what's right for you as you make that change.
Great. So for all those that are listening that are thinking about Medicare, Medigap, Medicare Part A, B, and C, and D, and you want a little bit of help, it's what we can do to help you. We don't sell them. We don't make money on them. There are specialists that work for all these companies that sell them. They're paid either on salary or commission. They are compensated. So their job is to get you the United AARP plan or the Kaiser or whatever you want. I'm going to see if there's another question here as I'm doing this. But we'll help you. Our job is just to help you make these life decisions and make it easier for you. So that's our job, and we'll run it by you. There's no charge for that. It's just what we do. So go ahead. You were going to say something?
Yeah, no, I'm reading some of the notes here, and someone had mentioned like a healthcare savings plan. So I didn't know if you wanted me
Go ahead, please.
To address, a healthcare savings plan, but also address people working after 65. So if you work beyond, retirement age or 65, there are a couple of things you want to think about. So if we have time, I'm happy to jump into it.
Go ahead, please.
Okay.
Take a few minutes.
So there's a couple of things you want to think about, and thanks for the individual who, I think it was Marianne, you're my name twin. You had mentioned healthcare savings plans. A couple things you want to know. Number one, if you're working for a company that has less than 20 employees, the question is, hey, I've got less than 20 employees, I'm 65 or beyond, what do I do? You want to enroll in Medicare A and B. So make sure you're proactive. It's going to become your primary coverage. Now you have a second, and then what happens is your employer-based coverage becomes secondary. Second situation is you're working beyond 65, your company is bigger, it's got more than 20 employees. Now the question comes to, are you collecting Social Security or not? If you are collecting Social Security while working, most people aren't doing this, but if you are, you're automatically enrolled in Part A and B once you turn 65. And then what you want to do is opt out of Part B, because remember, Part B is the one with the premiums. A doesn't have any premiums, so you just kind of proactively opt out. The reason why I say most people aren't doing that is because if you're if you're working and collecting Social Security at the same time, I would definitely pick up the phone and talk to Elliot about this, because the Social Security Administration is going to be penalizing you and withdrawing some of your money, sort of withholding some of your benefit from you. So conversation for another day. But the second option is, hey, I'm 67 years old, still kicking, still doing my work, and my company is massive. What do I do? Don't worry about it. You don't have to do anything. You don't have to pick up the phone. You don't have to tell anybody anything. When you do quit your job, or when you do leave your place of employment, you need to immediately reach out and enroll. Now, what they're going to do is, let's say at 68, you decide, hey, it's my time. I'm gonna retire. I feel like I'm ready to go travel the world, right? As long as you can prove that you had that coverage over the last few years, you're golden. If you didn't have coverage, that's when you can get some penalties. So you want to be cognizant of that. So the reason why I brought up, the healthcare savings plan is that if you're not collecting Social Security, a lot of people will say, well, if I'm not collecting Social Security, should I just go ahead and enroll in Part A? And we'll say, you can definitely enroll in Part A, and that's totally fine. And it'll pick up some of your hospital expenses and things like that isn't covered by your employer. But once you're enrolled in Part A, you can't contribute to that HSA anymore. And a lot of people forget about that. So if you have an HSA you've been contributing to for a while, and then all of a sudden you enroll in Part A, just know as soon as you engage with the Medicare system, they take away your right to contribute to that program. So,
Great.
okay.
And I also was told that on the commercial side, that if somebody is looking for dental plans in retirement, Delta has a family of dental plans in retirement in California. So I want to thank you very much for being part of this. That was great. Just to clarify, I thought that when you're turning 65, 90 days before, 90 days after, you have to go and either decline or enroll in Medicare. Is that not true?
Yeah, so you've got to, so if you're 65 and you're ready to enroll in Medicare, you've got about a 7-month window to actually enroll to avoid like penalties and things like that, assuming that you are going to enroll. If you are not, if you're, like I said, that last situation, which is, hey, I'm working, I've got coverage. I haven't heard that, I was told, and based off of my research and my conversations with the SSA and things like that, is there's no reason for them to even communicate with the SSA and the Medicare system.
Okay.
As long as they can prove, as long as they can prove that they had coverage.
I can see a little confusion on that one but we do advise everybody that within 90 days, either side of their 65th birthday, if you're still working, decline it. And if you're going to go on it, go on it. But I'm just afraid that they're going to start hitting them with a penalty later on.
Yeah, don't quote me. And you know what? I'm not superwoman here. So if there's something I missed that fell in the cracks, please,
okay.
Yeah. Elliot, I'll let you have that one, because I hadn't heard of that, but that could be very well the case.
Yeah. So I want to thank you very much for doing this, and I hope people on the other end got some really good, valuable information from this. We're going to edit it and repost it so you can share it with friends. And I also want to say we're going to be doing this again next Tuesday of Meet the Expert. We're going to have the folks, this at 10 in the morning Pacific time. We're going to have the folks from JP Morgan talk about first a market update, and then how do you profit in this economy and take advantage of what's going to happen. We are surgically buying, we're surgically selling too, in portfolios, because we think there's opportunity. The bond market is totally inside out, upside down from where it should be. And of course, everyone here knows how the stock market's performed. So you don't need an education on that online. So that's going to be our first set of speakers. Our second set, we're going to be talking about, we have a speaker talking about what's called the surviving spouse checklist. In other words, what do you do? How do you prepare for when the first spouse passes away? And so everybody's on the same page. I could kind of end with a joke about that. Buddy Hackett, he's an old-time actor, old-time comedian, was on the Johnny Carson show, and he was coming to the end of his career, and somehow mortality came up as a subject. And Johnny Carson asked, how are you preparing for mortality? And he said, I just bought a new condo in Florida. And Carson looked at him puzzled and said, why would you do that? He said, I'm preparing to give it to my wife's second husband. And so he was trying to poke fun at the whole thing as well. Not to be sexist on that, but an old joke from Buddy Hackett. Anyway, I want to thank you very much for being part of this. Marianne, that was great. Lots of great information. Thank you for the folks from Fidelity at Transamerica for helping out so much on this. And we'll see you next Tuesday at 10 in the morning Pacific time. And feel free to take a look at our website, www.prosperityfg.com. You can email me for questions, concerns, and comments at Elliot, that's ELLIOT, at Prosperity, F as in Frank, G as in George, prosperityfg.com. And we will get back to you immediately with some good answers, good responses. Lots of people work in my office that can help you. Lots of great advisors who will be happy to help you at any given time. So have a great Tuesday and be safe and healthy.